Hi everyone, it's your girl Veronica. Welcome back to my YouTube channel. It's another evening. We thank God for this. And today I'm going to discuss about something that bothers a lot of us, a lot of our brothers, a lot of men in the society. And it is through my experience, it causes a lot of instability in these men you see around here. And I'm going to talk about erectile dysfunction. I'm going to describe what is erectile dysfunction. I'm going to talk about very few causes of it and how we can prevent it briefly, and at least how it can be managed, because it's manageable. Welcome. And what is erectile dysfunction? Erectile dysfunction can be described as inability to keep an erection to satisfy your sexual needs during sexual intercourse. So when you get somebody, or you get a client who comes into your office or comes to my office and tells me that, Dr. nowadays I'm unable to perform, first of all, what do we ask? You ask this patient at least three things, so that you can know whether this person is having that erectile dysfunction. Ask this person, can you have an erection? Can you able to have it? The answer might be yes or no. And if this person answers that one, ask him again, can you keep it to sustain you? That is another question. That may be yes or no. Do you have an erection? Can you keep it, or can you sustain it? And for how long can you be able to sustain it? And when you ask those questions and get answers, you're going to know what is this person having. And most of the signs and how do you diagnose this erectile dysfunction, it's mostly through history. It's just that patient, that client, who is going to tell you what he is experiencing during his sexual activities. History taking is enough. There are no lab tests that can at least show you that this person is not having erectile dysfunction. And this is mostly because sometimes it's brought about a lot of testosterone. Those ones usually brings about it. And let me briefly discuss kidogo about the causes. And these causes, I can divide them into two: physiological causes and the psychological causes. And the physical causes can be diseases like heart diseases, like diabetes, like hypertension. Also, thyroid diseases can cause it. There is also other diseases like Parkinsonian diseases. Also, there are other things like smoking, alcohol intake, drug use, chewing of cat. All those things are also physical causes. There are others like surgical complications, might be having spine surgeries or back surgeries. Those ones also can interfere with erections. There are other things like injuries through the pelvic area. The pelvic area is below, around the low back there. Those injuries can also cause that problem. Also, there are treatments like prostate treatments or cancer treatments. Also, those ones can cause erectile dysfunctions. And there is another thing, obesity or high cholesterol. And erectile dysfunction is associated with high triglycerides. When a lipid profile is done and you find that high triglycerides in the blood, and this person complains of it, it might be the cause. I'm not saying that it's necessarily the cause. It might be the cause. Also, let me talk about the other things which are psychological. Those that are brought about through the interference with the brain activities. Let's say the way this person is thinking. We have stress. We have also the depression. Also, relationship problem. You might be fighting with your spouse all the time, all the time complaining, find that you are not sober, you are thinking a lot, you are not satisfied. Most of the time, sex is mindset. You set your mind and you do it very well. When you are not when you are not you are not okay, when you are not comfortable, you cannot be able to go about it. And these things it's not good, because it personally, not having a good erection can also lead to all these things. There are also other things like drugs, those drugs that can cause erection dysfunction. There are some drugs, medications, like drugs, some of the drugs, not all of them, that controls the blood pressure, hypertension, drugs like prolonged use of diazide, others like anxiety treatment, that is antipsychotic drugs. Others are like opioids. Opioids can cause. There are others like hormonal drugs, antidepressants. All those drugs can also cause the erectile ED. Let me call it ED. It's a bit easy. So there are those myths. Those myths that come about, like does riding a bike for long cause ED? No, I don't think so. Whether riding a bike can bring such a problem. And others, I ask, masturbation and pornography use, do they cause ED? Yes, they do. Those one they do, but not so much. And the best thing to do is to avoid them. For example, when you are more addicted to pornography or masturbation, that is the only thing that can sustain you. And I don't think when you get a woman, you can sustain that erection, because you are used to seeing those things on the screen, and you think that you're supposed to do like whatever you are seeing the screen, of which what you're supposed to do, it's what you personally can do, and that one will be very, very much okay. So those are the few causes of erectile dysfunction, and these things, the best way to do it's if you want to prevent this, if you want to treat this, it's just managing the causes, like hypertension, diabetes, thyroid diseases. Those one you just treat, make everything to be at the controlled level with the right drugs. If you see a person comes to you and tells you, Daktari, I've been having ED, and then you ask about the history, you find this person is hypertensive. When you ask about the kind of drugs this person is using diazide, you can connect all those things. All diabetes, the sugars are high, you connect all those things and try to manage them appropriately. That way at least you'll be helping this person. Another thing, it's advising this person on weight. If they are obese, if they are overweight, just talk to them about exercises so that they can reduce their weight, so that they can be able to perform well. Also, there are anxiety, like the psychological effects, anxiety, depression, intimacy, relationship. The best way to tackle this one is counseling. You talk to somebody. There are others like sex therapies. So those ones, they have specialists who talk about sex therapies, and they will help these people. Also counselors, they will talk to this person and try to bring down whatever is bothering them in their mind, and that way you'll be helping them a lot and a lot. And don't forget to talk about smoking and alcohol intake stoppage. And if you look around, you find that most of our young men, they are involved themselves with cat chewing. Cat chewing is miraa. Utafuna kuchonga, kuchonga all the time. They are chewing miraa, and this one is also something that I can associate it personally. I can associate it with ED, mostly to the young. All the drugs, cocaine use, heroin use, even marijuana, smoking, all those. So the best way, it's like just lifestyle change. Just stop all this, stop smoking, stop taking alcohol, stop taking drugs, and that way you are going to to get some improvement, you're going to get something good. At least you will be able to do well in bed, will not be able to complain a lot. There are treatments, some drugs which are associated with the treatment. Yes, can be treated with the drugs. There are those, they usually call it blue pill. These are the sildenafil, and there is another one called tadalafil. Those are the drugs that can cure erectile dysfunction. Also on me, I like giving this name multivitamin, at least to boost their energy, so that they can be able, when you give this multivitamin at least for 2 to 1 month, you usually boost their energy to be able to perform. So those drugs are good, but I will not say that they are bad if they are used well.